Hi, I'm Lisa Squires, Senior Communications Advisor with Alberta Health Services, and this is Health Matters. Today we're going to be talking with Sarah Woods, and Sarah is a registered nurse with the Alberta Healthy Living Program here in the South Zone. And today we're going to be talking about heart disease and some different things that might affect the heart. So thank you for being here, Sarah. I think most people know that smoking isn't good for us. So how exactly does smoking affect the heart?
Well, smoking is really going to increase our blood pressure and decrease our exercise tolerance. So really, we're not going to be able to do those regular things that we need to be doing during the day quite as easily. It'll also decrease our good cholesterol and really increase our tendency for blood to clot, which really is just going to lead to the process of atherosclerosis, which is really the buildup of fatty substances inside of our arteries and puts it at risk for heart attacks, strokes, etc.
So if a person is diagnosed with a high blood pressure, does that automatically mean that they have heart disease? And what are some things that they might need to be aware of or maybe think about doing?
Well, high blood pressure is really defined by numbers. So if you know your blood pressure, basically you want to make sure that your blood pressure stays below 140 over 90 millimeters of mercury, and that's just the unit of measurement. However, if you do have diabetes, we really need to keep that blood pressure 130 over 80. Okay, so it's just a little bit lower for that. Diagnosis of hypertension or high blood pressure doesn't necessarily mean that you have heart disease, but the higher your blood pressure is, the greater your risk for having a heart attack, for that heart disease to develop, and also some kidney disease.
And what about stress? You know, you always hear about how stress can really wreak havoc on the body. You know, how much does stress really contribute to heart disease?
Well, stress is going to increase that blood pressure, and there's really a lot of evidence that's going to suggest that there is that relationship between the risk of cardiovascular disease and environmental and psychosocial factors that we were all exposed to. I mean, let's face it, we all have stress, but we're going to feel it and react to it in different ways. We don't really know exactly how stress is going to contribute to heart disease or how it's going to increase our risk of developing it. But stress may affect some of the other behaviors that we're choosing to do, such as smoking or inactivity or overeating. We also know that the surge of adrenaline that's caused by severe emotional stress is going to cause that blood to clot more, okay? And then, of course, it's going to increase our risk for heart attacks and strokes. Heart attacks and strokes. Whether or not stress turns out to be a major risk factor, learning to deal with our stress is really going to decrease our risk of that heart disease.
And I'm just wondering too, like, what about, I've heard about metabolic syndrome. I'm sure there's probably a lot of people who haven't heard of that or might not know what that is. So what exactly is that, and what are some of the symptoms that somebody might have it?
So metabolic syndrome, is a cluster of risk factors that are going to increase the risk for heart disease and diabetes. So if you're concerned about it, the best thing to do is to talk to your doctor. And they're going to help you identify the presence of metabolic syndrome. So it's going to be identified by the following. So an elevated blood pressure that's going to be equal to or greater than 130 over 85, an elevated fasting glucose or fasting blood sugar, which is going to be equal to or greater than 5.6 millimoles per liter, a greater waist circumference. So for men, it's equal to or greater than 40 inches, and for women, equal to or greater than 35 inches. As well as elevated triglycerides and a reduced good cholesterol or those high-density lipoproteins.
Great, thanks, Sarah. I think that those are some really great tips on, different things that people can do out there to, prevent heart disease and at least try to reduce the risks. So thank you very much for being here. I'm Lisa Squires, and this is Health Matters.